Now we'll hear from Dr. Bill Barberesi. Bill is the Wade Family Foundation Chair in Developmental Medicine, Director of the Developmental Medicine Center, and Associate Chief of the Division of Developmental Medicine at Children's Hospital Boston. He is Associate Professor of Pediatrics at Harvard Medical School. Prior to joining Children's, Bill was Associate Professor of Pediatrics at the College of Medicine, Mayo Clinic, Chair of the Division of Developmental and Behavioral Pediatrics at the Mayo Clinic, and co-director of the Mayo Clinic's Dana Child Development and Learning Disorders Program. Bill's clinical practice includes children with developmental delays, intellectual disability, autism spectrum disorders, attention deficit hyperactivity disorder, learning disabilities, and behavior problems. Bill's research includes studies on the epidemiology of learning disorders, ADHD, and autism. He's currently PI on a number of studies, including one on the long-term outcomes for children with ADHD, as well as on the genomics of ADHD. Please welcome Dr. Bill Barberesi.
So I hadn't planned on discussing my Midwestern associations, but I feel compelled to do so now, not having met Chris before. But I just have to tell you that as someone who grew up and was educated on the East Coast, I got off the plane in the Midwest, and I stayed almost 20 years. I think they just didn't, tell me the way back, and I'm easily confused because of my visual spatial skills. Also, I feel compelled to add that I, too, dislike Tom Brady because I grew up in New York, and I'm a Jets fan. So there you have it. So it's True Confessions Day, apparently. I want to tell you a little bit about some of the things that we've been doing in the Developmental Medicine Center at Children's Hospital Boston with our colleagues across the institution to address several things that I think are particularly challenging right here and right now in the care that we provide for children with autism and in what we hope and dream will be the future of the care that we can provide to children with autism. Beginning with this, the diversity in diagnostic and treatment approaches. For those of you who are not in the field and have experienced the assessment process for a child with autism on the patient end of the equation, you may not appreciate that the fact that unfortunately there is not yet truly a gold standard for diagnosis of autism. A lot of people put their heads together in multidisciplinary teams in an effort to do their best at identifying the problems that a child has, but we're far from a gold standard. And as a result, it's really complicated our efforts to answer other important questions about autism, like what treatments are most effective and what approaches are most efficient in caring for individuals with autism. Another area that we're addressing in our ongoing work right now is that of outcome measurement. How do we know that what we are doing is working? How do we know that when we see children in follow-up, the progress that they're making or not making is something that we can assess precisely so that we can make common sense, effective recommendations to improve their outcomes? And how do we compare old and new approaches? Our goal is always to do better tomorrow than we're doing today. But how can we achieve that goal if we can't measure what we're doing today? And the third area is clinical and translational research. And in particular, as a pediatrician who views time as very precious, because as you know, the life of a child zips by very quickly. And as a parent of 3 now adult children, I can attest to that personally. And so we have to answer this question: can we shorten the time from discovery to change in clinical care? And those are the things that I want to tell you a little bit about today with regard to initiatives that are underway in our institution. So let's start with this issue, addressing diversity in diagnostic and management approaches to ASD. This year, toward the beginning of the year, our institution established an autism spectrum disorders task force encompassing individuals from across the institution who provide care for children with autism, including those in developmental medicine, as well as neurology, psychiatry, speech and language. And it was done in part because we recognized that there are multiple approaches. As there is no gold standard, what's happened is that different disciplines have established different ways of dealing with autism. And frankly, it's hard to know which approaches are most effective, efficient, and for that matter, family-friendly. And so we're asking ourselves those questions in the context of the work of this task force and trying to find out, in the long term, how do we assess the components of care that are most effective. Some of the first and most important steps that we've taken have related to the development of clinical practice guidelines. Through the efforts of a multidisciplinary consensus team, an extensive review of the literature was completed, as well as expert opinion, which is not a bad thing to rely on when you don't have as much data as you would like. That effort has included, as I said, developmental medicine, neurology, genetics, psychiatry, as well as our colleagues in speech-language pathology. And the goal of that work group, as part of our task force effort, has been to establish uniform and high-quality diagnosis and management that is provided to every single child who crosses the threshold of Children's Hospital Boston, regardless of who they see and in which department they are seen. As a result, we have now developed practice guidelines both for the assessment and treatment of autism that we expect will be living and breathing documents that evolve over time and that we will measure. And this year, we will be systematically implementing those guidelines across the institution, including certification of every clinician who provides care to children with autism to ensure that they are knowledgeable with regard to what we believe is a state-of-the-art approach to autism, and that they are in fact practicing in a manner that's consistent with those guidelines. So we're going to be measuring compliance and outcomes in the context of daily clinical care. In fact, we will be measuring outcomes in a way that's embedded into the very fabric of what we do, and in fact have already started to do that. And that brings me to the next issue that I raised, that of measuring outcomes in ASD, so that we know that we're providing the best care for every single child. And it's really a fundamental challenge in the field. There are a whole variety of ways to assess function of children with neurodevelopmental problems. But frankly, as with the diagnostic approaches, there are no gold standards. There is no definitive way to know when a child comes in to see me if their language is really better in a meaningful way, if their ability to interact with their peers is really better in meaningful ways. Behavior is somewhat more straightforward, but still complex to assess. And so we're developing infrastructure to support our effort to better assess outcomes in a more systematic and precise way, building on an approach called eDMC, or electronic DMC, which is a system that I'll show you in a second that was developed under the leadership of Drs. Eric Fliegler and Eugenia Chan, both from the Department of Pediatrics, Eric from General Pediatrics, and Eugenia from our Division of Developmental Medicine. eDMC is a user-friendly electronic system that's really directed at parents and teachers and other people who interact with children on a daily basis. And the goal of the system is to allow us to collect real-time information from people who know the child best and who are therefore best able to tell us how things are going. The system that we've developed is confidential, it's HIPAA compliant, and it involves automated scoring of questionnaires, reports, and other information that's available to all clinicians, not only at the time of a visit with a specific child, but in between visits, so that we can better monitor their progress in a more systematic way. eDMC started as a pilot project in the Developmental Medicine Center in September of 2010, and thus far we've enrolled over 1,200 patients in the system, allowing us to dramatically increase our ability to get information from parents and teachers to help us assess the progress that our patients are making. In fact, we're now able to get that information from 80% of parents and 60% of teachers. That latter number may not seem too high to you, but the reality is that because of logistics and communication difficulties, historically, although we make decisions about care based on what's going on in school, most people are only able to get that information about 10 to 15% of the time. So that's a dramatic improvement, and we're aiming much higher. We've been able to decrease by 10 to 15 minutes the time that's spent in gathering some of the information that I'm going to show you. And what that allows us to do is, by collecting this data in advance of appointments, to devote more time to the real concerns that a child and family bring to us when we see them. That time that we have is very precious, and we want to be sure that we use it in a maximally effective way to address the issues that need to be addressed. And we can do that if we know up front how things are going. So this is a little look at some of what the DMC interface involves. This is a kind of a screen that a parent might see, asking in this instance about ADHD symptoms using a standardized questionnaire. We've found from parents and teachers that it's pretty easy for them to do this, a lot easier than it is with the old paper forms. They click on their responses, and then the information is automatically scored and templated, so that anytime I wish, and in advance of every single appointment, I get something like this, a summary of key information about how that child is doing. In this instance, the example is for a child with ADHD, so I'm provided with information about medication side effects, about the Vanderbilt ADHD rating scale, about a quality of life measure, which we've embedded in this program for all the children that we serve, because we think it's important to try to systematically assess quality of life, not just specific symptoms, and also questions about how a child is doing overall, global impression. And we also get things like this. In the case of the Vanderbilt scales, the system scores the questionnaires for us automatically, depicts it graphically over time, and allows us a lot of different ways to assess a child's progress in a much more precise and systematic way. In this case, you're looking at severity of ADHD symptoms, and although I don't have a pointer, if you look at that gray bar in the middle, that reflects timing when, in this case, a stimulant medication was started, and you can graphically see the decrease in ADHD symptoms. It's information that we've always tried to get, and that, in fact, our practice is dependent upon, but that we have not until now been able to get systematically, but we are with eDMC. So the next thing I want to talk a little bit about is the third issue. How do we go from discovery to clinical practice? And I want to tell you specifically about our recent efforts in clinical and translational research in autism spectrum disorders at Children's Hospital. One of the sad truths about medicine is that the average time frame, from new discovery to change in clinical practice historically is 17 years. And that's a fact that's emerged over and over again from historical reviews of new discovery and practice patterns. Clearly, that is unacceptable. It is completely unacceptable, in particular when one is a pediatrician and realizes that in 17 years, a whole generation of children will have been allowed to grow up without benefiting from new science and improvement in care. And in order to shorten this goal, we focused our efforts in developmental medicine and with our colleagues in other departments on building better infrastructure to expedite clinical research and translation of that research into change in clinical practice. And so we now, for our neurodevelopmental programs, have dedicated project management, study coordinators, the new electronic database that I just gave you a sampling of to help us assess outcomes, not just for our patients, but also for every child who's enrolled in a research project. We have faculty who are specifically trained and supported in clinical and translational research in ASD and related conditions, and they are busy. We've also extended our collaborative efforts beyond Children's Hospital Boston in the case of developmental medicine through DBPNet, the Developmental and Behavioral Pediatrics Research Network, which is funded by the Combating Autism Act and is a consortium of the 12 leading developmental and behavioral pediatric programs in the United States, working together now to improve care for children with autism and other neurodevelopmental disorders. One of our first studies is now underway, trying to assess in a meaningful way, on the ground, practice variation in the care of children with autism, because we have to begin to understand better and more precisely what we are doing now so that we can improve it. We can no longer rely on just impression. We have to use data, and we need to get it fast. I'm going to highlight for you several clinical trials that are underway at Children's Hospital Boston in developmental medicine and in collaboration with our colleagues in other departments. The first is a Seaside Therapeutics-sponsored multi-center clinical trial assessing the safety and efficacy of arbaclofen, which is a new therapeutic agent, in the case of this trial, targeting core symptoms of autism. We're also participating with Novartis in a multi-center clinical trial assessing the safety and efficacy of a new therapeutic agent developed based on the mGlu-R theory of Fragile X syndrome in adolescents with Fragile X syndrome, and that, of course, is based on work by Mark Baer at MIT. And we're involved in a Rett syndrome trial in a collaboration with the Department of Neurology based on animal work of Dr. Sur at MIT. That's just a sampling of some of the projects that we're doing right now, but I'm particularly excited as a developmental pediatrician who was trained here some 25 years ago. And unfortunately, as someone who is standing before you, having to admit that much of what we do today is the same as what I learned to do 25 years ago. And that is not acceptable. And so I think perhaps the best way to summarize this section of my remarks today is to say to you that we are absolutely committed to expediting the rate at which we can not only get new knowledge, but translate it into action on behalf of children by developing the kinds of systems and supports that I've shown you today so that we don't have to wait 17 years for new discovery to make it from the lab to individual children and their families. Putting it all together, I'd like to share with you my vision of what I hope the future will be like, and certainly what we are committed with our colleagues to making our future. That is an evidence-based practice based on guidelines that we all agree upon, that we will act to improve as we collect data about them every single day, which we are already doing, that we will continuously measure outcomes using eDMC so that we know that we are actually doing things that are helping a child make meaningful progress, that will continually modify our practice to ensure the best outcome for every child, that will continue our collaborations with our colleagues in neuroscience, our own laboratory of neuroscience, our friends at the MIT Brain and Cognitive Science, and certainly our colleagues in the private sector, that we will build on our national collaboration in developmental and behavioral pediatrics, and that we will seamlessly integrate clinical and translational research into our practice so that we ensure that we are providing the best care to every single patient today while doing our very best to improve the care for future patients. Thanks for your attention.